Governor, the hospital industry appreciates what you have done for the patients in New Jersey. You have increased charity care, you have increased graduate medical education at a time when it's very, very difficult to increase anything. You certainly have shown sensitivity to the urban environment, to the safety net hospitals. We appreciate that, and we hope that continues.
I've always thought that New Jersey's hospitals are one of its most vital assets and the healthcare safety net for our state's most vulnerable. Hospitals are the places where our babies are born, where our family members recover from accident or illness, and where many folks spend the final moments with their loved ones. Beyond just the personal impact that hospitals have on our lives, they also have a major economic impact upon the state of New Jersey. And hospitals are often the largest employers in our communities, and they inject more than $18 billion into the state's economy. So the jobs they provide and the economic activity they provide are extraordinarily important. So we've had a tough couple of budgets that we've had to deal with as a state, and despite that, we've recognized the importance that hospitals play both in our economy, as I mentioned, but also in very difficult economic times for folks who have lost their jobs, lost their insurance. And this is the place of last resort that they'll come to, is to a hospital, to be able to get health care when they need it. So in the budget that I signed in June, we increased hospital funding by $20 million. And in FY11, we increased funding by over $36 million. We've also made the way we fund hospitals more predictable and transparent, because we know that many hospitals depend on our state funding to provide mental health and medical care to tens of thousands of New Jersey residents who either don't have health insurance or are underinsured. And so we've listened to hospital leaders' concerns about the need to have a clearer picture of funding down the line so they can better plan to effectively manage their finances. The Trinitas Center of Regional Education, a new $5.3 million community and medical education facility in Elizabeth, will open by the end of this year. Gary was telling me about this as we were traveling around the hospital. It's a new building that's built predominantly through their efforts in philanthropy and other efforts that they have put together to be able to put this new building together. It's going to be a great resource for health education, for resident training, and training for other healthcare professionals. Trinitas is a lifeline for the community, and I want to thank all the talented staff. I got to meet a lot of them. As you saw as I was making my way in here, I got to take pictures with a lot of them too on my way in. It's great to know that by seeing the smiles on their faces that they love their job. And there's no substitute for loving your job. When you come to work every day, especially the people who come to work here, I sense that they know that they're making a difference in people's lives.